Good morning everyone and welcome to Health Horizons. Our series is designed to support leaders in your business by addressing the challenges and opportunities that are shaping the future of workplace health and wellbeing. It's part of our commitment to keep you updated on emerging trends, cutting-edge technologies and evolving practices in healthcare. We aim to anticipate challenges and opportunities that shape the future of workplace health and wellbeing so you always feel one step ahead. So, today we'll be discussing men's mental health in the workplace and how this can become a silent crisis. 80% of men won't seek support for their health immediately out of fear or anxiety. Despite some progress, men continue to suffer in silence when it comes to their mental health. Organisations need to think about how to better engage men with access to support and treatment so they're getting the help they need before it becomes more serious. Over half of young men in the UK feel pressure from society's expectations, believing they must man up when experiencing challenges. 33% of men said fertility problems had a negative influence on their work life. And men account for 75 to 80% of deaths by suicide, and suicide is the largest cause of death for men under 50. Today, we'll explore how organisations can adapt their wellbeing strategies to boost the engagement of men's mental health in the workplace now and in the future. By acknowledging the issue and encouraging men to seek help, organisations will benefit from talent retention, increased productivity and engagement. So, for today's session, I'm pleased to be joined by our four experts. Joining our panel is Dr. Naveen Puri, Medical Director at Bupa UK Insurance. Welcome.
Thank you.
Charlotte Gentry, returning for a second go as CEO, founder of the IVF Network. Welcome, Charlotte. Sean Greenaway, male fertility coach. Morning.
Morning.
And then Alice Hendy MBE, CEO and founder of Ripple Suicide Prevention Charity, will join us later on Zoom. Please send us your questions throughout the sessions and we'll answer as many as we can get to a bit later on. Okay, so today's session, we are going to split into two sections. Firstly, we'll explore the hidden drivers impacting men's mental health with a focus on fertility, relationships and loneliness and how this can manifest in the workplace. In the second part of the session, we'll discuss why suicide is the leading cause of death for men and what steps businesses can take to proactively address suicide prevention. So lots to get through, let's get started. I am going to come to you, Naveen, first, I think. So firstly, I want to talk about the hidden drivers impacting men's mental health. So from your perspective, have you observed the rise in the silent crisis around men's mental health in recent years?
Yeah, thanks, Richard. I mean, I wouldn't say I've observed so much a rise, but more of an uncovering and a greater awareness around men's mental health issues. That's certainly been the case. When you consider that all of us experience mental health issues, but certainly for men, they can be much more fraught and perhaps not as much openness around them. And I think that comes from the way that we're socialised as men and raised, really, and how cultural norms give us a sense that we need to be manly, as you said, man up, notions of manhood, just really get in the way from that conversation being had. I think also, comparatively, women's health is really making real strides because of a great awareness of things like menopause, endometriosis, period conversations. And when you compare that then to the lack of progress being made with men, it's even more the case that men are falling behind, both in terms of physical and mental health conversations and dialogue. I think what's also, though, encouraging is that there's now a greater recognition about some of the drivers for men's mental health issues. We didn't really speak about things like loneliness or fertility or, burnout and those kinds of things, whereas there's much more of a spotlight on those now. And so I think because there is more of a spotlight, conversations are being had slowly but surely, and between the generations as well. I think there's much more of an openness amongst a certain generation of men to speak about their mental health and lean into vulnerability, which perhaps we didn't see from a previous generation as well. At Bupa, we've teamed up with Martin Kemp to run a campaign called Take a Lift, and Need a Lift rather. And what Martin did was get in a car with 3 people and engage in conversations around mental health. We've got a clip that we can share with you now.
I can feel my body go.
Hi, I'm Martin Kemp, and with the help of Bupa, I want to encourage men to open up about their mental health challenges. So I'm taking them on a drive.
Right, so sexual function and mental health. Let's talk about it.
Let's do it.
So I want to talk to you about caring for an elderly relative and how that might affect the carer's mental health. I want to talk about how a dad's mental health can be affected by the mental health of his children, especially teenage sons.
Just be very open and honest with
your children?
I think that's the hardest thing to do, is kind of admit that you're not mentally okay.
I felt like I was so alone and so isolated, and it's a really horrible feeling.
I need to take care of my physical health and my mental health so that I can take care of my teenage son.
It's one of the hardest but one of the best decisions we made for my mum and for my own health.
So basically we need to talk to our mates more about getting help.
Yes.
You need a lift?
Thank you, Naveen, and love Need a Lift. Such a good resource. So, Charlotte, I'm going to come to you next. At the IVF network, you talk to thousands of men a year, and one challenge for any person experiencing fertility issues is that it can feel very overwhelming and isolating. What strategies do you think are most successful in fostering a workplace environment where men feel supported?
Thank you, Richard. I think the most important thing is enabling an open culture at work for men to feel safe, to be able to have those conversations. I think one of the biggest challenges, and I certainly can talk from personal experience, not necessarily on behalf of my husband, but we went through 9 years of fertility challenges, which obviously affected both of us mentally as well as me physically. But the underlying issues around that for my husband were very much on a mental basis, and he had such a lack of control that in terms of what was going on, it was very, very hard. At the IVF network, we provide a very safe haven and a community where now tens of thousands of people are talking to each other. Through our community feed, we provide a safe space there for men to be able to have those conversations with other men. We actually have, interestingly, 38% of people who are engaging in our platform are actually men, which is a really positive statistic, that it's not just women who are engaging in this topic now. It is very much men who are recognising the need to be able to have those conversations. I think within a workplace culture, that open conversation and finding those safe spaces is really, really important, but also the diversity element and the inclusion piece, and businesses doing more and more that they can do to create that environment through diversity and inclusion, and for LGBTQ as well. Being able to know that there is a resource available, having access to the right experts and knowing where the right information is to seek help is also a really key part of this, as well as it's a very expensive process as well, whether it's a mental health challenge that you're facing and knowing where to go to get that right experience and advice or what have you. And those are all the kind of elements that we support. I think finally, ensuring that businesses have the ability to be able to educate and upskill line managers to be able to know exactly what people are going through and how to help men is really, really important. And that's something that we also help with. So just being able to navigate those conversations in the right way is a really, really key part of the puzzle.
Yeah, great. Thank you. It's interesting, isn't it? As with so many things on Health Horizons, creating the right environment is such a big part of this to make it, okay, and give people a place to go. So I'm going to come to you, Sean, next. From your personal experience, how can fertility challenges impact your life and mental well-being, and how can this manifest in the workplace?
Yeah, it affects every element of your life, and you think of how much of your waking week really that you can spend in the workplace. It's quite natural that it will impact you there. It certainly did for me. For around a year and a half, actually, I hid what I was going through from my employers, and I was going to a multitude of appointments or taking telephone calls and having results even delivered whilst I was at work. Those appointments often was taking annual leave or sometimes even sick leave to go to, or trying to change shifts around at work, and that was all just increasing my stress and having a knock-on impact of my productivity at work, because I was showing up and trying to be the me I was before, knowing that we were having fertility challenges, but I was anything but. My whole world was imploding outside of work, and I was still just trying to put on that brave face, because also the fertility issues were from my side. So I was looking around and trying to seek men that were speaking about it or supportive communities, and there were none. So it just compounded that feeling of shame and stigma that I was the only one, and because that's how it felt. And I thought that I would be really throw myself to the wolves if I was to put myself out there and speak to my employers in what was a very heavily male-dominated workspace as well.
Yeah, it sounds like a really difficult time. I mean, this question isn't scripted, by the way. You might want to have a think about it. But I'm interested in that. In sort of what sort of environment was the workplace that you were in, and it feels like from what you've said that it wasn't necessarily an environment where you would, seek help within the workplace maybe, but I might be putting that on you, so I'm interested in that.
No, it's fine. I worked in a large open plan office, and so because I knew there would be people behind me who could see my computer, I wasn't doing things like looking up workplace policies. I didn't know what support was available.
Yeah.
And such was the culture that you'd only typically, unless you were in trouble, you wouldn't have meetings with your line managers apart from your annual performance review. So if I was to then go and stand up and say, "Oh, can we go and have a chat?" it turns heads.
Yeah.
People assume that you're in trouble, and so I just felt like didn't have the space to open up.
Yeah.
And when I did, eventually by email, because I felt comfortable enough, it was almost I had to open up in the end rather than wanted to, because I was going to have operations, and I would need more than a day for the operation and then the recovery. I mean, the second one being major surgery, which would need 4 weeks recovery. So there's not really any way you can hide that.
Yeah, so you almost felt forced into having to open up rather than it being an environment where you felt like that would be a good thing to do.
Absolutely. But once I did, everything got easier. My line managers were brilliant. And the way the compassion and empathy in which they received that information and then treated me afterwards with respect and asked me what I needed, it was second to none. And it just lifted a whole massive weight from my shoulders.
Great. Thank you. Thanks for sharing. Okay, I'm going to come back to you, Charlotte. So what advice can you give to organisations that may be struggling to know where to start or that want to improve their mental health support for men impacted by fertility challenges?
I think that the first thing that's really important to mention is that 1 in 6 people is likely to be affected by this issue. And therefore, if you're sitting in an office with 5 other people around you, the chances are that one person is struggling in silence. So I think that's really important to understand. That's a very, very high number, actually. And 1 in 4 people is affected by miscarriage. And I want to make this point because whilst miscarriage and baby loss is a very difficult scenario for any woman to find themselves in because of the physicality of what that does, there's very little support and help for the partner, any man that's going through that and who's also experiencing that kind of loss. Even during clinical visits, and we experienced a number of miscarriages through our fertility treatment, so to speak. The emphasis was definitely focused on myself as opposed to the man. And my partner. And so I think recognising the fact that a man is grieving in that situation and the same level of mental health challenges is impacting the other person is a really important piece for any organisation to recognise. And that 1 in 4 number in terms of miscarriage or baby loss is a really high number. So the support really needs to be there just for that piece alone. Having a support service that provides access to many other people so that the isolation piece falls away is a really, really important piece. And I think a lot of organisations are thinking, we'll throw money at the problem in terms of treatment or what have you. The one thing that we experienced is that whilst it's wonderful to have access to funds, unless you know where to spend them, it's actually relatively futile. So having the knowledge and the support and all of the other elements first really is the first port of call, and that content and information, it's very, very hard to gain diversity of opinion from the number one specialists in order to make the right measured decisions, and that's what we're providing in this scenario. So whether it's us or whether it's any other form of content available, that's really a very important place to start alongside the community aspect to enable men to have a safe and anonymous forum where they are able to share their concerns. And anonymity for men, I think it's fair to say, is very, very key, because men are still very concerned about others knowing about the challenges that they're facing. So I think that's really, really important. And just building awareness of these challenges is really, really key. So in terms of workshops, perhaps, and events of this nature, to create more and more brand awareness around the fact that these problems are really prevalent in the workplace, and therefore that demands a level of support surrounding that. So those are the key things, really, I think, that businesses should look for.
Yeah, awareness, and that stat at the start, it was 1 in 6, wasn't it? I mean, that is quite a shocking number. So I think awareness built around that, and then where to go rather than Google. I mean, we've all tried Google before. That isn't great, is it?
It is also a global phenomenon. So it's not. We are actually alarmingly in a declining population because people are choosing to have children later and what have you. So, with that in mind, certainly for businesses that have got global offices, it's becoming more and more of a problem.
Yeah. Great, thank you very much. So Naveen, coming to you, how do you believe societal changes are influencing men to open up about their mental health?
Yeah, I think we certainly see that cultural and societal norms are shifting, and there's now a generation of men that are much more open about their health issues. I think Sean was just beautifully articulate there about talking about infertility in a way that I don't really see often, and that's really quite a great way to role model what we should be doing, although it's easier said than done. I think what I'd also emphasise is that while conversations are being had and being leaned into, there still is a silent majority who aren't having conversations and aren't being reached. So I wonder, when we run events like this, who signs up for it? Is it the people that we already have converted to the cause, or is it individuals that actually perhaps need to be having the conversations and will take a lot from it? So that's always a challenge that I think we need to reconcile with organisations like ours. I think also within society there are broader conversations being had around diversity and inclusion. Charlotte alluded to some of those as well, and while I think that's a really good thing and is a sign of progress, sometimes those conversations can alienate men as well. I think when you've got terms like toxic masculinity, for example, I think people like you and I who work in the field and have a sort of an academic understanding of what that means appreciate the significance of it. But if you're an everyday man or indeed a woman on the street, aligning toxic with masculine almost sends a message that can be quite conflicting. And I think if you look at that across the whole diversity and inclusion space, sometimes there is a nuance and a language and a way of communicating that can be quite alienating. And so people tread quite carefully around it and don't even venture into having conversations of that nature, when really leaning into it might be better for everybody, but with a bit more forgiveness and understanding around the use of terms and things of that nature. I think what I would also say is that gender norms have shifted as well. So no longer is the man the breadwinner, no longer is the female partner the homemaker. Thankfully people are interchangeable in what roles they take in the family and in the home, and so I think that also shifts expectations as well and has evolved the conversation on a societal basis as well. The last thing I'd say is that during the pandemic, we certainly saw that access to healthcare and accessing routine resources was really restricted for everybody. So that if you consider those that weren't accessing healthcare and resources in the first place, such as men, the pandemic accelerated that. And unfortunately, we're still in the hangover effect of that. So it's the case that wait times are, even more longer than they were historically, which means that men, when they're not accessing resources, are waiting even longer than they were before as well. So a few things to be mindful of there, I'd say.
Yeah, sure. I mean, we're lucky. We work for Bupa, and it's definitely an environment where you can open up if you want to. It does make it easy. But the language, creating the right environment, so important. I mean, personally, I had an accident a few years ago and had some mental health challenges coming back to work and with life in general. I found it, I don't think you ever find it easy to open up about, but the environment made a difference, and we've got a number of leaders who role play, that's the wrong word, role model, and that, which I think helps others to get into that space as well. Okay, so Sean, I'm going to come back to you. So in your experience, how do you think factors such as longer working hours, increased job-related stress and changing career expectations are impacting on men's mental health?
Hugely. And actually to touch upon a couple of aspects that have been brought up there, men not sharing, for example. So I mentioned the office environment that I worked in. I sat next to a female and then another guy the other side, and he and I would often go out for beers. But then when I started opening up to my peers about what we were going through after I'd done so with my line managers, my female colleague said, yeah, well, I don't want to say his name, but the guy that one away from you went through this with his wife. She said, seriously, what do you guys talk about? It's like, well, not that. But that's the thing, it's that, and this was 8 years ago. There is a shift, thankfully, because I went through those periods of extreme overworking because of what I was going through. I was often trying to escape what was going on outside of work by staying at work longer, and then what that led to was my management, for example, going, well, Sean's. This is I hasten to add before I'd opened up to them, but they'd say, well, Sean's doing really well, and then almost the expectation that I could be given more tasks. That actually was really counterproductive, because it was then leading to a lot of stuff outside of work that I was desperately trying to avoid, but it was increasing my isolation and loneliness from my friends, from my wife, because I was not wanting to talk about what I was going through, which essentially was grief. And a big part of grief is depression. And what I was doing was then leading to that. But that's what I thought I was doing, was running away from that. But I was running towards it. And it really wasn't a healthy period of my life. Kind of sleep went out the window, unhealthy eating habits, and not exercising as much as I should have. Certainly, it just increased that stress that, again, like I said, I thought I was doing this to not. But it was like an ebb and flow, because there were those times of overworking, whereas there were other times where I was receiving life-changing news whilst at work, or another disappointing result. And then I was very much at work but not present, not working that much, but there in present in body but not in mind. For example, the phone call that I received to tell me that I was infertile, that I had no sperm. I received that whilst I was at work, and I just went back into the office and carried on for the rest of the day. Essentially in a state of shock, and that's what so many people are going through every day, and it's having that fostering that community to be able to share and open up. Like I said, the weight that came off my shoulders once I did, it changed everything for me.
Yeah, so sharing and really getting it out there, so you get that support network around you. Not easy to do though, is it?
No, absolutely not, and it's a huge step, but it's probably the most important. And that's not whether it's at work or anywhere, because then once I started sharing at work, I then started opening up more with my wife, and then that eventually led on, again, a few steps down the line, but I opened up to my friends who I previously hadn't shared with, because I assumed that they wouldn't be able to, they wouldn't know what to do or say, because they had all had children easily and naturally. Actually, the way in which they received that information and handled it, and the respect that they showed me, the compassion, the empathy, it levelled up our friendships. And actually I realised that by not sharing with them, I was robbing them of that chance to be that friend that I needed them to be. And they were everything and more once I did.
Yeah, great, thank you. It's good learning for all of us. So Charlotte, in your view, how do you expect workplace culture and policies to evolve so that they can better address the silent crisis in men's mental health?
So thank you for that. Firstly, I would say that things are beginning to change, and I'm going to use a couple of experiences actually that we've had recently, because one of the key elements to the client relationships and the client engagement piece that we work on heavily with our client base in the corporate market is in-person pop-ups actually, and providing that space to generate open conversation and create that open culture. And that's probably the primary piece, really, enabling people to feel safe at work, that it's not going to compromise their career, it's not going to affect the way in people treat other people at work and what have you. And recently we've been into actually a relatively small law firm and did a pop-up there, and one of the partners actually came up to me and started explaining his story in the kitchen area quite openly and what have you, which was really quite fantastic to be able to see that. And they'd provided a boardroom where we can have private conversations with the odd individual. And we had another lady who wanted to talk. She'd actually had a hysterectomy, and she wanted to talk about what the options were and what have you. And people are starting to become more open, and our experience is demonstrating that people are prepared to share more, even in a private environment, but actually that the quantity of those cases is becoming greater and greater, and we're experiencing that when we're in our clients' offices and what have you. So that's quite interesting to see and to watch. Another example is I was recently on another event with one of our clients who, one of the panelists was explaining the fact that they'd been through fertility treatment, and they were actually receiving, it goes back to what Sean was saying, they were receiving test results and they had nowhere in the office to be able to go to have a private conversation. They found themselves in a hallway because all the boardrooms were busy, there were no areas of privacy that they could go to take the call, and so they found themselves trying to have a very sensitive conversation and not allow others to hear who are walking past exactly what the conversation involved, and that was very traumatic for them, understandably. So I think some of the key wins for organisations are providing those safe spaces and enabling those areas where people are able to have private conversations, I've actually seen, pods, if you like, sort of mini telephone boxes that you can walk into, which are a step in the right direction, I think. Also ensuring that a fertility policy is created and and people know in the organisation that actually that policy exists, because we've discovered that a lot of policies are being crafted, yet actually the comms piece internally hasn't been that brilliant, and so people don't even know what they're entitled to, and that it becomes part of a D&I, an overarching D&I policy, which is really, really important. And we've seen some of our clients do this, and that's actually a really massive step in the right direction. The inclusivity piece is really important, especially we've done events specifically for how to attract and retain Gen Z, actually, because it's not just about whether or not you're looking to have a family today or tomorrow. It's about future-proofing fertility, which is becoming an ongoing challenge, and building awareness around this. So creating brand days and making that information more accessible to younger people, because we're all digesting information in different ways now. So thinking about the demographics that you might have within an organisation and creating those brand awareness days and enabling that is also highly important. So I think those are some of the key areas, and understanding that still for men, anonymity is still really important for a lot of people. Whilst it's amazing that Sean has, found a way to share his experiences, not everybody is like that. And so still creating those areas of anonymity is still really important.
Yeah, great, thank you. So loads around environment, policy and anonymity, easy for you to say, easier for you to say than me anyway. It's probably just worth saying and reminding everyone that those on a corporate policy that we run at Bupa, that we never send anything back to an employer, is anonymous, completely anonymous. So just want to reassure people around that. Right, Naveen, coming back to you. So what emerging challenges in mental health are anticipated in the future, and what should employers be mindful of?
Well, I alluded to the fact that, post-pandemic, there's been a real increase in demand for all healthcare services, including mental health services. And unfortunately, we are going to continue to see that for many, many years to come. So I would certainly signpost the fact that, there are alternative mental health provisions out there now. There are obviously the face-to-face services, but during the pandemic, a lot was done to develop digital services as well. And platforms like Jack, which we have a partnership with at Bupa, really enable us to leverage support and help in a way that doesn't require somebody to seek out a physical, physician or a clinician to access. I think also another challenge is around the evolving nature of work. So we know that automation, the advent of AI, is going to render things like existing roles obsolete and existing skill sets somewhat redundant. So I think for men that can be a real challenge, because a lot of our identity comes with us being able to be the breadwinners, be the providers, and if we're attached so much to our identity around work, to have a challenge to that can be really quite detrimental as well. I'm also conscious that social media is a huge force for good, but also can be a huge source for some harm as well. And certainly generations of men are now growing up with social media as their source of information around news or health or other insights as well. And sometimes the messaging or the content on there can be somewhat inaccurate and really quite damaging as well. Things like geopolitical events as well. I think the uncertainty within the world can be a really challenging thing for a man as well, and for all people, but particularly for men who perhaps value stability and some sense of normalcy as well. I'd also say that there's, going back to the conversation about mental health resource, young people are also affected massively by mental health, and there's an increasing awareness of their mental health needs. So if you're a father or a carer of a young person, that places a challenge to you as well. You've got to respond not only to your own mental health and well-being, which you probably haven't got an acumen or a language for, you've also got to then respond to the mental health needs of your children, perhaps even your partner as well within the family unit. So I think there's knock-on effects in many places, and while there are challenges, we're certainly looking to respond to them, and events like this I think play a part in that as well.
Great, thank you very much, and thank you to my panel. So if you've got questions for our panel, then please get those in. We'll ask those a little bit later on. And now, what you've all been waiting for. I know you love a poll. So here's our first poll of today. Is your organisation doing enough to support men's mental health in the workplace? Yes or no? Okay, we'll come back to that one later on. Now, we've just discussed how relationships, fertility and loneliness are contributing to men's mental health, which has now become a silent crisis, and how this can manifest in the workplace. Our panel discussed how crucial it is for organisations to provide and encourage men access to the right support before their conditions become more serious. Research shows that mental illness is the most important risk factor for suicide. More than 90% of people who die by suicide struggle with their mental health and/or addiction. In the second part of today's session, I'm delighted to welcome CEO and founder of suicide prevention tool Alice Hendy MBE, who will join us to discuss why suicide is the leading cause of death for men and what steps businesses can take to proactively address suicide prevention. Welcome, Alice. Thanks very much for joining us.
Hi, thank you very much for having me.
So, Alice, can you share with us why Ripple's journey began and what motivated you to develop this life-saving technology?
Certainly. So my journey, unfortunately, stems from personal experience. November 2020, Wednesday the 25th, about 5:28 in the morning, and my family and I received a knock at the front door with 2 police officers stood in front of us. They asked to come in, and very bluntly, they tell us that about 2 hours prior, they had found somebody that they believed had ended their own life, and they identified that person as being my brother, Josh. Josh was 21 when he took his own life, and my only sibling. And in the immediate aftermath of losing Josh in the weeks and months that followed, I became obsessed with going through Josh's devices, his mobile, his laptop, his tablet, desperately trying to find answers as to why he thought suicide was his best option. And when I did that, I discovered that Josh had been, for about 3 months prior to him ending his life, going on the internet and conducting harmful online searches, typing in how he could do so, how he could end his life. It was those searches that actually provided my brother with tips, encouragement, even instructions on how he could go about doing so. And so that really is where my idea stemmed from. I couldn't believe this stuff existed, and I wanted to intervene if anybody else in the future felt that low and that desperate that they were conducting these harmful searches. I wanted to intervene, intercept them at that pivotal moment, and instead signpost them to mental health support services. And that really is what Ripple is. It's a piece of tech. It intervenes at crisis moments. It's available to download as a browser extension and be placed on Wi-Fi, and it's saving lives around the world.
Thank you very much for sharing. Firstly, I'm so sorry. It sounds absolutely terrible, but amazing that something so good has come out of such a terrible situation. What sort of factors can increase the risk of suicide, particularly in men?
So I think the first thing to say here is suicide is so complex. There is a huge combination of different individual, community, societal factors that all interact with each other to increase the risk of somebody experiencing suicidal thoughts. And there are also multiple workplace factors that can contribute to that as well. And that can be, for instance, low job security, pay, job-related stress, long working hours, shift work, workplace bullying, and many, many, many more things as well. But men are statistically less likely to speak openly about their feelings due to the stigma of being perceived as weak. And there is still very much that responsibility to be strong, to not show that level of vulnerability, to be the breadwinner. In actual fact, opening up and speaking about how you feel is a huge, huge strength, and it takes an enormous amount of courage and bravery. And I think the other thing to mention here is there are certain conditions that exist that are proven to be very closely linked to an increased risk of suicide. Financial struggles is a big one. This was absolutely the case in my brother's instance. People with problem debt are 3 times more likely to have had recent suicidal thoughts. My brother Josh applied for 72 payday loans in the 6 days leading up to his suicide that we had no idea about. So it absolutely plays a part. There's also things such as alcohol and substance misuse. People who abuse substances or have an alcohol addiction are up to 14 times more likely to die by suicide than others. And another factor here, which I am part of, unfortunately, is if you've actually been bereaved by suicide. People bereaved by the sudden death of a friend or a family member are 65 times more likely 65% more likely to attempt suicide if the deceased died by suicide than if they did by natural causes. It really makes the person themselves who's left behind equally as vulnerable. So there are a variety of conditions, but it's extremely complex and is different for everybody.
Yeah, thank you. Some shocking stats in there, that's for sure. So how can businesses identify the signs that may mean someone might be thinking of taking their own life?
So I think the first thing to say around this question is sometimes there are signs, sometimes there are no signs at all. And that's really, really important to note here. But in terms of some signs that could be included as to indicating really that somebody might be finding things tough, there might be an expression of isolation. Somebody might be withdrawing from themselves, from colleagues, from friends, family members, and so on. There might also be a decrease in their work performance, missing targets, missing deadlines, not perhaps performing to their usual standard. That might indicate there's a bit of a problem there in completing tasks. You might also have something a little bit more obvious, which is actually speaking about arranging end-of-life personal affairs. And that can include things like making a will or selling your possessions, giving away your possessions. My brother, for instance, was selling all of his PlayStation and Xbox games and consoles and his technology in the lead up to his death. As I mentioned in the previous question, you've also got an abuse of alcohol or other substances. If somebody is displaying signs that they might be struggling with substance misuse, that could also be an indication that they're finding things tough. Change in appearance is another one. Now, that could be lack of hygiene, it could be putting on weight, it could be losing weight, it could be wearing clothes that haven't been washed. At first glance, you might think, oh, that person perhaps, is a bit lazy, which is certainly what I thought of my brother. In actual fact, it was the complete opposite. He wasn't lazy at all. The simple task of washing, putting on clothes, was such an enormous ask of him to do when he was battling those thoughts of suicide that it just seemed untenable for him to do that. And of course, you've got the more general signs of somebody looking, feeling depressed, mentioning suicidal behaviours, and actually outwardly saying that they're finding things difficult as well. But really important to note that as many of these signs are, absolutely ones to be looking out for, sometimes there are none at all.
Yeah, absolutely. And often there are none, as you say, but I think I wonder whether there's a role for leaders to play in business, knowing their people really well, and if they spot something, then just opening up the conversation and asking if they're all right is a good step forward for people within the business. Moving on to my next question. So from your perspective, how significant do you think the role is of the workplace in suicide prevention, and how do you believe that the workplace support needs to evolve in the future?
I think the first thing to say here, Richard, actually just on your point that you've just mentioned there, that taking that courage to actually ask somebody if they're feeling suicidal is so important, and that could save a life. There's a huge myth around the suicide prevention that if you ask somebody that they are if they're suicidal, you'll be putting the idea in their head, and it's simply not the case. In actual fact, if you have that courage and bravery to open up that conversation, the person on the other side of that conversation there actually has then the ability to open up about how they're feeling and will probably feel very relieved that you've asked them. So it's really, really important to do that if you feel somebody that you know is struggling. But in terms of the question that you've asked me here, how significant do I think the role is of the workplace in suicide prevention? I mean, workplaces are essential. It was said on the panel earlier, we spend so much of our days, of our time, of our weeks, months, years, lives at work. And therefore, the importance of a proactive approach to suicide prevention is huge. Suicide is preventable, but it's only preventable with timely, evidence-based interventions. So by taking a holistic approach to mental health and suicide prevention, employees can form almost a safety net that actively safeguards individuals when they are most vulnerable. And some steps that employers should take in order to create a suicide safer workplace include trying to reduce the stigma surrounding the topic of suicide. Events like today that you're hosting are so important. It's talking about a subject that, frankly, is hard. It is hard to talk about, but it's so desperately needed, and it enables that open communication. You've also got some steps here that employers can take by providing access to mental health and suicide prevention training for all their staff. If we're not trained in what to look for and what to do, how are we supposed to know? Install smart tech such as Ripple, of course, to intercept any web searches that might be relating to self-harm and suicide. Unfortunately, these searches do happen in the workplace. If somebody is suicidal, they might well be searching on the internet for answers, and Ripple is there as a safety net in the background. And also a focus on work-life balance. That could look like having flexible hours, ensuring that everybody is provided with the time that they need to manage their personal lives where and when needed. And it was again touched on the panel earlier, that could be for medical appointments. It could be for looking after children, picking up the kids from school. It could be for having time off for operations. Whatever it is, having that flexibility to do that safely is really important, and will add that job security to the person who's already going through tough times. And focusing on other elements which might also come into play when we talk about mental health. So financial well-being, providing support for people who might be finding things tough with their finances. HR leaders play a crucial role in this, and they can, along with all of the staff in an organisation, build a safe and more supportive workplace for everybody. But ultimately, it's about starting a conversation and taking a proactive approach to suicide prevention, which is what we're doing today in today's session.
Great, thank you so much, Alice. And so many great tips. I mean, frankly, it's a scary subject, isn't it? And the sort of ultimate taboo subject. But as you say, something we really need to talk about more. And I really like the tip for line managers, actually, just asking somebody if they're feeling suicidal, which doesn't feel that comfortable or intuitive, but is a really great tip for everybody. Thank you very much, Alice, for speaking with us today and sharing all the great work that you do at Ripple. We'll be getting that in the Norris household very shortly. I can tell my children that when I get home. We know that suicide can have a devastating impact on families, friends and communities, and it can have long-lasting effects. That's why it's imperative for continued support to be offered and available to those who need it. So before we end today's session, Sean, I know this is a topic that you have some really personal experience of, so it'd be great if you could share that with us.
Sure, yeah, personal and unfortunately very recent as well. My dad died by suicide this summer. So yeah, it's still very much something that's like the everyday for me, and my family and all of his friends as well. It touches everyone, as Alice mentioned. It's just so tragic, so sudden, and of course it comes back to that thing that we've mentioned, is we spend so much time at work, and how employers show up in those times of extreme need for their staff, it really can set them apart, or unfortunately in my situation with this one, really shine a light on how poorly staff can be treated sometimes, because it's, of course it's not to make this about me at all, but it rocks your world. It turns it upside down. It removes any sense of security that you had, especially when it's your father. I'm 41 years old, I still need my dad. He was 61, and he fell very much into that kind of previous generation of man up, men don't share, and I feel really sad for him that was the case, because I wonder what the outcome could have been had that not been so entrenched in him. But it happened on Sunday. I told my line manager that I wouldn't be in the next day and why, and obviously he said, okay, no problems, and that was that first week. I didn't hear from them, which is absolutely what I needed. the second week, in the early to mid part of the week, it started being intimated to me and implied that I should be coming back to work. And it just put me in such a anxious state, an insecure state. So then I went back the following week, and I walked into my office, and a peer said, I'm so sorry to hear about what happened. My line manager was stood next to him, said nothing. And he said, oh, my peer said, are you okay? And I said, well, not really. I could have done with more than 2 weeks off, but that's seemingly as far as this organisation's compassion stretches. And my line manager just went, yeah. And that was all I heard from him. So, you can, because any normal human being can think about how that would be received. And when you're an employer and you have a responsibility for your staff, just think about how things are received and what they might want as a person, because obviously that then stretches into everything that we're here today about recruitment and retention, etc. So it can be, sometimes the smallest things can be the most impactful, either one way or the other.
Yeah, absolutely. Thank you so much for sharing. I'm so sorry for your experience, and it does remind us all how much impact just your line manager can have on you and your experience. And if you want the hard facts on business, how long are you going to stay there if you're being treated in that way? So
exactly.
you don't need to answer that now. I don't want to get this up. Okay. Thank you very much.
Thank you.
Right, we're going to move on to another poll, and then we're going to go to our Q&As. So any questions you have, then please get them in. So our second poll is your organisation taking steps to proactively address suicide prevention? Yes or no? Right, we'll come to our questions now. I haven't looked at these, so you might need to give me a second whilst we're answering the poll. Dr. Naveen, I'm going to come to you first. So what are we doing about prevention?
Yeah, so prevention certainly has a role. I think for too long, healthcare have been very reactive, and we wait for a problem to arise before we actually sort of intervene. But actually, there's lots we can do in the prevention space. So around prevention, we're starting with things like awareness, making people aware of what signs and symptoms to look out for. Alice described really beautifully some of the signs and symptoms, for example, for someone who might be in distress or depressed or potentially pre-suicidal, and we can replicate that across the board for all men's health conditions, both physical and psychological as well. There's also a driver around encouraging men to be much more proactive in their health as well. One thing I'm conscious of is that men are not medicalised in the same way that women are. So we don't have appointments for cervical smears, for example, or mammograms. We don't get pregnant and therefore see our doctors on a regular basis. But that's not to say men can't see their doctors. They very much should do. And I would certainly encourage them to make use of their doctors for anything that they have a concern around. I think men are often quite embarrassed and ashamed to see their doctors, but from a clinician's perspective myself, I was a GP for well over 10 years. There's nothing I've not seen or not heard, and actually it's really humbling to be able to have a man come to you and open up about their health issue and to be able to reassure them or signpost them in the most appropriate way. Sometimes just bursting that bubble and getting through to them can be the unlocking of so much support and help. So prevention certainly plays a role, and one that I would certainly encourage men to be proactive around as well.
So don't be shy. Get
Absolutely, we've heard it all before.
Yeah,
yes.
you've heard it all before, yeah. It's scary in itself. Right, okay. So, Alice, I'm going to come back to you, and you touched on this just before, but I think it's such an important part of the conversation that I'm keen to come back again. So, suicide is such a sensitive topic. Can you offer any advice to a line manager about how much to step in and how much to give space to that person?
Tough question, because it's a really fine balance, to be honest. I think as long as you ensure that you are making sure that the person is aware that you are there to listen to them, that's really, really important as a first step. It's then up to that person, of course, as to whether they choose to open up and talk to you. But it needs to be in a safe space, so not in an open office, basics like going somewhere private, maybe asking them if they want to go for a coffee, and then leaving it with them to have that conversation. A typical example I can give is when I first lost Josh, people didn't know how to communicate with me. And so their response to that was to not communicate with me at all. And the silence was deafening. So it's better to say something and make sure that you know that that person is aware that you're there to listen to them, or rather than not saying anything at all, because that can actually do more harm than good. So a very fine line and a fine balance, but the key is here, if you are worried about somebody, please ask them about it.
Great, thank you very much. As with so many things we cover on Health Horizons, starting the conversation is so important, isn't it? And you've just touched on somebody opening up, but if somebody opens up to you about feeling suicidal, how can we help other than giving them resources and signposting?
Question. Listening, but listening without any judgment, not changing the conversation, not offering them your advice and guidance, because to them, what might be an enormous issue to you might be very trivial. So it's really important to listen without judgment, without interruption, and to give them the space that they need to open up. If the person is actively demonstrating signs that they are suicidal, it's also really important to not leave them alone. Now, that might sound obvious, but if somebody has told you that they're suicidal, frankly, you're probably going to feel quite panicked by that inside. So it's really important that you remain with them, as hard and as tough as it is for you. Make sure that they've got somebody there to support them. Now, that could be a GP, it could be a family member, it could be a friend, it could be a neighbour, whoever it is, make sure they're not alone. And make sure that you're putting a plan in place with them on how they can stay safe. Now, that could be something as easy as organising their time for the rest of the evening. What are they going to do? Okay, we're going to make dinner at this time together. Okay, we're going to watch this television programme together. Anything really to create a bit of a plan as to how they can stay safe in that specific moment. Resources obviously are really key. And there are a huge plethora of resources that are available for people to access and utilise. It's not just telephone lines either that exist. We do, of course, have brilliant telephone lines like the Samaritans, but we've also got text services by shout that someone can access, which is less intrusive for a lot of people, particularly men. We've also got web chat facilities that you can access through the charity Calm, which again is for men and less intrusive. There's also a number of apps that people can download to help build their safety plans and gain resources. A couple on my list here are the Hub of Hope, where you can put in your postcode and it will open up a whole host of different resources that are available to you within your location. Or Stay Alive, which is an app you can download by the charity Grassroots. It's packed full of resources and you can build your safety plan together on that app. So I just wanted to flag those, but that's my kind of tips really on how to help somebody there.
Great, thank you very much. So obviously starting the conversation to start with, but listening without judgment, I really like that as well. And then making a plan, don't leave them alone, and then lots of resources. By the way, the resources will tag into any follow-up so everyone can see that afterwards. Right, final question coming to you, Charlotte. So do you have any recommendations on how we could encourage men on how to talk more about their health, especially anonymously, to protect their confidentiality? Can't believe they put anonymously in there.
Yes, of course. I think that the safe environment is absolutely key, and it spans all of the conversation that we're having today. So making available the spaces to be able to have those conversations. I think one of the worst feelings ever, and I certainly was privy to this, as was my husband, is that somebody looks at the floor, doesn't know what to say, and walks on by because they just don't know what to say in a difficult situation. And that's the worst way to feel actually as the recipient, because you just there's nothing to say in a particular situation, but just knowing that, just I'm so sorry to hear of your news is enough. And providing those safe spaces, the community piece is absolutely key for people to feel as though that there's a forum that they can go to from an anonymous perspective, and creating, I think, communities within organisations where you've got champions with people within that organisation, such as people such as Sean, for example, who are prepared to have those open conversations, and building a small community of men within an organisation that can champion this. I mean, within organisations that we work for, the miscarriage piece seems to be a very big element, and baby loss, and there are whole communities and committees being built around that particular piece on its own. So that should be reflective of men and women, not just of women building those, and more men championing those discussions within organisations. And I think if other men see that certain individuals are prepared to champion these conversations and put their head above the parapet, it then means that other men will join, and that's a really important piece.
Great, thank you very much, and thank you to all of my panel today, particularly for sharing such personal stories, and thank you, Alice, for joining us by Zoom. That's us done for today. It brings us to the end of our final session of the year. It strikes me, as with many of these, creating the right environment for people to open up, have the conversation, and for line managers to actually start that conversation and then know where to help people and signpost them to is so important. So I hope that you've taken that and many other things from these sessions. So that's us done. To support your line managers, the Bupa Academy will be launching a new men's health module in December. For more information, please speak to your account manager and they'll talk you through it. I'm pleased to say that Health Horizons will be returning in the new year with our first event discussing how businesses can better support the health and wellbeing of the LGBTQ community. Thanks for joining us today. Have a great Christmas. It's creeping up on us very quickly, and we'll see you very soon.